Hello, everyone. We'll give it a second before we get started. Just a couple of housekeeping things and some additions for this round. We also have the Spanish channel for those of you interested. So if you want to adjust your screens and your audio channels to accommodate what you're looking for today, now is the time. And we'll give it just a second to get everyone in before we get started. For those of you just joining us, we'll give it a second to get everyone in. We have video and ASL, and we've pinned the appropriate videos for our presentation. But if you want to adjust your screen for what you may need, please do so. We also have Spanish language as an option if you want to adjust your language settings before we get started. All right, thank you for joining us today for our COVID-19 update. And if anyone just joined that maybe missed my earlier announcement, we have the Spanish language as an option for today if you want to change any of your language settings or any of your video settings before we get started. And I would love to take this opportunity to introduce our participants. We have Dr. Rachel Herlihy, State Epidemiologist for CDPHE, Dr. John Douglas, Executive Director for Tri-County Health, and Dr. Eric Brantz, Chief Medical Officer for CDPHE. And we'll go ahead and get started with Dr. Rachel Herlihy.
Great, thank you. Good afternoon, everyone. So I'd like to start here where we normally do with an update on our case counts in the state. So this is a figure that shows you our 7-day average number of cases in the state by report date. And this shows you cases that have occurred in the state since the beginning of the pandemic. And in this figure, you can see 3 distinct waves of illness. We have, of course, our spring wave of illness that we experienced in July, and then now our much larger fall wave of illness. When looking at this data, it's always important to keep in mind that that spring wave of illness may look smaller than it actually was because we know we had limited access to testing here in the state in the spring. But as we take a closer look at our fall wave of illness, I want to point out a couple of things that we've been seeing in the last couple of days here in Colorado. So in general, it does look like we had a peak in the amount of transmission in the state in mid-November. And since then, we've really seen cases stabilize a bit. We saw a decrease from mid-November for several weeks, and then we saw a little bit of an increase again. And now for the last couple of days, we've once again seen a declining trend. Overall, we know that these numbers are still really high. There's still clearly a large amount of COVID-19 transmission that's happening around the state. And these numbers seem to be a bit unstable, meaning that the numbers are going up and down every couple of days. But overall, it does appear that we're in some sort of a high plateau with the amount of COVID-19 transmission that's occurring in the state. And we'll talk in a minute about what this means with regard to what we're seeing from the impact of Thanksgiving. But first, I want to take a closer look at our hospitalization data. Next slide. So here, once again, you can see the 3 distinct waves of illness we've had in the spring. Here you can more clearly see the large wave we had in the spring, you can see our summer wave of illness, and then now our fall wave of illness that is much larger. So here we see, once again, that same trend where we've seen a decrease in hospitalizations over the last couple of days in the state, where it again appears that we might be in some sort of a high plateau. Clearly, we're still seeing very high levels of hospitalizations due to COVID-19 occurring in the state, certainly the highest that we've seen since the beginning of the pandemic. But we do seem to have seen a little bit of a decline in the last couple of days, and that's good to see. So next slide. So as far as what is driving this change that we're seeing in transmission, so going from several weeks ago where we were seeing a rapid increase to now this high plateau, I want to talk a little bit about what we think might be causing that. So this figure shows you, again, our 7-day moving average of cases over time. And then it shows you a number of dates that are labeled with key events. So I want to start with November 26th, Thanksgiving Day. So you can see that on Thanksgiving Day, we had already experienced a peak of illness in the state. Numbers were coming down a little bit. But since that time, we've been in this plateau. The other dates that are labeled here are times when we would estimate on average cases that were exposed on Thanksgiving would first begin to have symptoms, next have a sample or specimen collected for testing, and then finally when we think those cases would start to be reported to public health. And you can see that we're really just a couple of days after that average time where we would start to see cases reported to public health. So at this point, we think one of two things could potentially be happening. One, it could potentially still be too early to see the impact of Thanksgiving. That's certainly a possibility. We might need a few more days worth of data. It might not be until the end of this week or early next week that we can see the clear impact of the Thanksgiving holiday and whether we saw less social distancing occur with that holiday like we have with other holidays, and whether that might translate to an increase in cases. The other possibility is that all of those things that were implemented leading up to Thanksgiving and all of the actions that Coloradans took leading up to Thanksgiving and during Thanksgiving are having an impact here and are potentially suppressing or decreasing the impact that we could be experiencing or we could have experienced because of Thanksgiving. If that continues to be our trend, that we continue to see this stabilization in counts or even a decrease in case counts, I think that's the most likely scenario. But again, too soon to clearly know really what is resulting in this high plateau in cases. Again, not clear yet to us if we're going to see an impact from Thanksgiving or not. And with that, I will hand it back to Heidi.
Great. And then I believe we're going to have Dr. Douglas talk about some things for Adams County.
Great, Heidi. Thank you for asking me to join. Is this the right slide?
Oh. Sorry, one more. There we go. Sorry about that. There we go.
Yeah, no problem. So this looks familiar to the slide Rachel just showed you, and I wanted to talk a little bit about what's happened in Adams County. We began to see increases early in the fall, really as far back as this graph goes. And county leadership, like us, was concerned about that, and we began to take a number of actions. These actions were all sort of based on the state's dial framework, whereas we began to exceed our incidence rates to remain at a certain level. We either began to take local action or worked with the state to move to the next level of the dial. The first local action we took was on October 16th when we issued a county-wide public health order. This order did a couple of things. It reduced spectators at sporting events, reduced the number of folks that could be on an athletic field for recreational sports. It prohibited alcohol sales after 10 o'clock, i.e. last call got moved up. And it limited gatherings to no more than 10 people in 2 households. That was on October 16th. By October 28th, we really hadn't seen any sort of change, and we worked with the state and were moved up to the orange level of the dial, which entailed a number of restrictions. Again, that was a couple of days before Halloween, October 28th. As you can see, things continued to increase, although I think any of these measures likely take at least one viral incubation period, 14 days, and potentially longer than that to take effect. At the same time as these things were happening, there was a tremendous amount of communication trying to further de-COVID fatigue the residents of the county about, we know this is tough, we know you're sick of it, let's see what we can do together. We weren't seeing changes quite as rapidly as we'd hoped. And so on November 7th, we issued yet another public health order. That one also continued to restrict spectators at sporting events. Restaurant indoor dining was limited to only people in the same household. Alcohol sales were cut back to 8 p.m. And potentially most impactfully, we issued a 10 p.m. curfew. That was followed by, I think one might argue, a plateauing. And then we, like other counties in the metro area and up and down the Front Range, were moved to level red on November 20th. And that's that marker you see there. I think in aggregate, what I would say is that I really believe that what we've seen is a combination of a sequence of policy changes. Honestly, they've been shotguns. They have lots of pellets. We can't tell which pellet is actually making the most difference. But I would also say that as more and more awareness about, oh gosh, this third wave, it's really bad. It's not a wave, it's a tsunami, began to hit people's consciousness. I do believe we begin to see the changes that Dr. Herlihy has described. And while I think she's right, it's too early to celebrate. I'm cautiously optimistic that combination of policy levers and really citizens taking responsibility is beginning to show a payoff for us. Back to you, Heidi.
Great, thank you so much. Now I'm going to take it over to Dr. France.
Thanks, Heidi and John. Yeah, I think it's hard to think back. What was it like during those weeks in October? We were not on a plateau. We were not in the Colorado National Monument at a high plateau. We were on a steep climb up, and day after day of steepening curves had us concerned that this would take us all the way up to the top of Mount Evans if we didn't pull some of those important mitigation policies. People of Colorado have been doing their part, it's clear, in following the recommendations. This is just to remind us that our dial for Colorado is a powerful tool. It's not necessarily rare across the United States, but not common. 22 states that have something similar to this. As you know, in green, we're considered most open, and in purple, we are at extreme risk and things are closed. We developed the different levels based on the early work in the summer of finding county variances, and from there, many stakeholder meetings led to the development of these different stages. The work involves us talking at the individual counties and local public health agencies about the right timing to move based on their specific circumstances. And it meets the goal that we all share in Colorado of local control for decision making. Next slide, please. I want to shift now and talk to you a bit more about vaccines. And of course, today is a special day when it comes to the COVID vaccine development. I'm glad you guys are here. Many, I imagine, are also online watching the FDA independent review of the vaccine safety and efficacy for the new Pfizer COVID vaccine. That meeting is happening today, and by the end of the day, we should hear more about how that went and what the recommendations might be of that independent advisory group. You'll remember from our past conversations that there's a lot of oversight when it comes to creating a new vaccine. In particular, while it's important that it works, it's as or more important to be sure it's safe. And so safety is embedded in all the different stages and phases of the work. What's been unique this year is that more often in the past, these phases would occur in a serial process. 1, 2, 3, if everything looks good in phase 3, then we start to build the ability to actually produce large amounts of vaccines. Because of the good funding from the federal government, of course, they were building both the supply of vaccine at the same time that the testing was underway. So what would take 7 to 10 years could be done in just a year. The other good news, of course, is that we're not making any changes on how we assess the safety by being able to do this in parallel rather than in a series of steps. We're now waiting today for approval from the FDA. The first approval will be for an emergency use authorization. We expect the ACIP, then the Advisory Committee on Immunization Practices, to review tomorrow and Sunday, making their recommendations. And it may be as early as next week that we'll have our first doses here in Colorado. Next slide, please. Vaccines themselves, of course, have a variety of components in them. The traditional vaccines have these proteins that stimulate the immune response. Our new vaccines that we're trying now, these messenger RNA vaccines, have genetic information that leads to our body's cells to create the proteins and incite the immune response. We know that when these are working well, the vaccine itself will cause local reactions. So where you're given the vaccine, it's going to be painful with that needle. You're going to have a sore muscle. You may have redness and stiffness of your arm. Indeed, I've heard folks who've participated in the COVID trials guess at which arm they were in, the placebo or the true vaccine, based on how sore their arm was after they got the vaccine. And we know that just because your body is going to be reacting locally, it will also react more systematically. So we'll hear about fevers, fatigue, headache. These are symptoms that affect the whole body system and not just limited to the arm. Next slide, please. 2 days ago, we were able to first look at the safety and efficacy data from this Pfizer vaccine. This is the data that today is being reviewed by the FDA's Advisory Committee. And this is just one of many tables that you can find in that Pfizer document. It shows us that indeed there are local reactions and system reactions associated with this vaccine. Here you'll see that there is a fever in almost 4% of people who are vaccinated with their first dose, and that vaccine fever goes up fourfold to almost 16% when you receive the second dose. It seems to be a common theme that with the second dose, the reactions are greater. We're also seeing from this data some look into non-serious side effects that seem to have occurred among those who were vaccinated versus unvaccinated. One item of notice was that there were 4 people in the vaccinated group that developed a facial palsy that's called Bell's palsy, where the nerve that runs the muscles of your face on one side becomes inflamed and those muscles aren't working. So you have a droopy face on one side or the other. We see Bell's palsy associated with virus infections in general. So certain cold viruses, chickenpox viruses, and others will sometimes be followed up with Bell's palsy. There's even been literature now showing that an infection of COVID-19 can also be seen to have Bell's palsy. And with some vaccines, we'll find that they too might cause something that the wild disease also creates. So the measles infection historically, I believe, had Bell's palsy as a complication from having measles. The measles shot also can cause Bell's palsy, though at a much lower rate than with the wild disease. We'll learn more about this with COVID disease and vaccine side effects as more folks are vaccinated. We heard too, just in the last couple of days, that people who have a history of severe allergic reactions to medicines in particular and vaccines may be at increased risk of having an allergic reaction to this vaccine. As you know, there were 2 cases identified in the United Kingdom. I'm convinced that today the FDA's Advisory Committee is looking over those cases and will give us guidance about what this means. It's important to note that these are serious serious allergies that allergic persons, if I could say, let me say that again. These are persons with severe allergies that were having these reactions and not mild allergies. So more to come. Next slide. I want to remind you that we now have on our website a nice place to find information about not only COVID, but the COVID vaccine. You can find the facts about the vaccine itself, our distribution plans, safety questions, all on this very complete webpage. So go to covid19.colorado.gov/vaccine, and you'll find a lot of information available. Next slide, please. It's important, of course, to remember that while we're all waiting for this rollout of the vaccine and have it be used throughout the state, following our prioritization plan, we need to continue with our basics, wearing our masks, staying 6 feet apart, avoiding in-person gatherings, working from home when we can, staying within our bubble, our household members. All of that is very important because it may be weeks and months before any one of us might be vaccinated. We need to do our part to keep that high plateau a plateau or a decline rather than see that our cases are going up. Signing up for exposure notifications is also very important. And you can see here, if you go to addyourphone.com, you can sign up to be notified if you happen to have been exposed to somebody with a positive COVID case diagnosis. Next slide. I'm happy to say that many people in the state have already signed up. Over 1.2 million installations of this app on our phone has happened. This is 22% of Coloradans. We know that even 15% of a population being signed up leads to important reductions in numbers of cases. 8% of cases were reduced and 6% of deaths were reduced when 15% had signed up for exposure notifications. So be sure to continue to emphasize the importance of downloading this app on our phones. Next slide.
Great, and with that, thank you so much, all of you, for presenting. And now we'll take it to our Q&A portion of the day. What we'll do is we'll use, as we usually do, the raise hand function. I will call on you if you could say your name and the outlet that you're with. And then if you have any questions that we don't get to or outside of the scope of what we talked about today, please send those to media_info@state.co.us. And with that, Vinny, we will start with you.
Thank you. This is Vinny Deljude, Bloomberg News in Denver. On the data, with cases leveling off, how many deaths are you anticipating in Colorado this month? Is it still in the 2,000 to 4,000 ranges we heard at the briefing last week on modeling? And on vaccines, I don't know if this is in your neighborhood or not, but do you know what qualifies at this point for a phase 2 jobs in terms of directly interacting with the public in high density settings? Thank you very much.
This is Rachel. I can take that first question. So we, at this point, have not yet seen a leveling off in our death data. I think that's important to mention. But we know that that data does lag behind the case data and the hospitalization data. So it's quite possible in the next couple of weeks, especially if we were to see this high plateau continue or a decrease potentially occur, that we would expect the number of deaths that we were anticipating, several weeks ago potentially decrease. But with that said, we do still anticipate, given how high our disease transmission is right now, and that constant mortality rate associated with that large number of cases occurring, that we could have another 1,000 to 2,000 deaths occur in the state by the end of the year. I would caution you to remember that it does take several weeks potentially for all of those deaths to be reported to the state. We do see a lag in death reporting, and so it might not be until late January or early February that we have a clearer sense of the number of COVID-19 deaths that will have occurred through the end of this year. But yeah, unfortunately, we do anticipate, with the high rates continuing at this point at least, that we will still see another 1,000 to 2,000 deaths.
Regarding the second phase and what specific jobs might be included in that, I'll back up and just remind us that in that first phase that will be starting shortly, we're focusing on our healthcare workers, the staff and residents of long-term care facilities. And those roles and people are pretty clear and will certainly keep us busy, I think, for the next month to get them all vaccinated. The next phase has us look to people at most risk for becoming seriously ill and those who are out in the community potentially being exposed or exposing others. And those are our essential workers. So people over 65 are people with diabetes, obesity, cardiac disease, immune diseases. Those are those high-risk groups. Essential workforce, quite a number on that list, of course, with bus drivers, transportation, grocery stores, people that work on power lines, those groups that are vital to our function as an economy, and who potentially, if ill, as an essential worker, may be coming back into their own community and spreading asymptomatically among their family members. So they'll be an important group, and the details of that will be forthcoming. We do expect we'll hear more about details on the priorities at the federal level on Sunday when the ACIP talks about how they'd like to see our prioritization to move forward.
Thank you very much. Thank you very much.
And thank you, Vinny. Meg, we'll take it over to you. If you could say what outlet you're with.
Hello, this is Meg Wingeter with the Denver Post. So if over the next few days we don't see a spike associated with Thanksgiving, what does that then tell you for, the upcoming holidays, Hanukkah and Christmas and New Year's, and how people should approach that?
Yeah, that's a great question. I think it would tell me that, all of the strategies that we used going into Thanksgiving would be incredibly important as we go into the winter holidays. So as we approach Christmas, New Year's, Hanukkah, all of the things that we did and all of the things that Coloradans did to lessen the impact of a potential surge from that holiday would be needed again for the next holiday.
Great.
And I know Dr.
Sorry, go ahead, Dr.
Just to say that I know Dr. Douglas is looking closely at that as he's thinking about his local school districts and how will they be able to be open in January for face-to-face schools. If the numbers stay stable, then it looks like, well, maybe we'll get through not only the holidays, but even post-holiday periods with lower numbers.
Sorry, Dr. France, are you inviting me to comment on that? I would agree with Dr. Hurley, Meg. And I would say a couple of things. We got to keep up the good work, number one. You are aware that houses of worship are given greater capacity limits as per a recent public health order. And we'll have to be attentive to sort of any possible dynamic there. The holidays, this is a time of year when people do congregate in houses of worship, especially those of a Christian tradition. And I really do think that in some ways what goes on in terms of these policies is not exactly, but kind of a zero-sum game, in the sense that if we've got more capacity happening in one sector, it's going to require a little more carefulness in another sector. And as Dr. France said, our schools are badly looking at the community transmission rates. They have had tremendous difficulty operating due to quarantines and illnesses among staff at the rates we've been at now. And I think all of them badly want to get back, especially in K through 5 and ideally beyond that, reopening after the new year. And so honestly, we probably need to not only continue the downward trend, but even accelerate it to give our schools more oxygen to get that done. So lots of moving parts to consider.
Great, thank you. Chris, we're going to take it to you, and if you could say which outlet that you're with. Chris, do we have you? Well, Chris, if you want to pop back in line, I will jump back up to you. For right now, let's go ahead and go to Brandon Thompson, and if you can say which outlet you're with.
Hi there, Brandon with Fox 21 News here in Colorado Springs. Just based on Dr. Douglas's comments, you mentioned that it seems like a conglomeration of things is leading to that high level plateau. Just based off of the chart you pulled up there, it seems like the most noticeable trend happened after those red level restrictions went into place. Would it be your guys' assessment that the red level restrictions were the most effective, and how might you gauge that?
Yeah, thanks for the question. It is difficult to tease out one part from another. That's definitely a challenge. And if anything, it seems like many of our interventions, as Dr. Douglas described, coming up through October and into November, help put us into the plateau. I'm very happy to see that over the last number of days, the cases are actually going down. And if I count the days backwards as to what might have helped with that downward trend, it might very well be that it's this red intervention that really moved us away from just a simple plateau into an actual decrease. These are assumptions, though. We know that staying 6 feet apart, wearing a mask, social distancing has to be in place so that our transmission control numbers are high. And there are many different levers that we're pulling to try and get there so that we're not on that exponential growth. It's difficult to say how much one or the other is responsible.
Great, thank you. And Chris Vanderveen, I think that we can get you going. Can you hear us?
Yeah, can you hear me now?
Yeah, excellent.
Right, sorry about that.
No worries.
Chris Vanderveen with 9 News. I have 2 questions. One, there appears to have been a fairly significant addition of deaths yesterday that really skewed your 7-day average substantially. And I understand that data lags. Is there any particular reason why yesterday was so heavy in terms of death reporting coming in? And my second question is in relation to school and school transmission. We've had a lot of inquiries about the fact that just when cases started to go down in the state of Colorado, was right around the same time schools started to close as well. Have you found any evidence that some of the decrease in cases and the stabilization is in fact possibly tied to the closure to the large closure of schools, and that there may have been some transmission inside schools that could have been responsible for the big wave we saw in November?
I can start. So you were breaking up a little bit, Chris, but I think we got most of your questions. So as far as the death data, I think the best way to look at death data is to look at it by the date of the death. We know that deaths are sometimes reported to us in batches as reports become available. And so I think looking at the date of report to us is not necessarily the best way to try and interpret what might be happening with deaths across the state. So the figures that we have on our website will show you dates of deaths occurring, and I would encourage you to look at that as probably the best way to interpret when deaths are occurring and how many deaths are occurring on individual days versus when they get reported to the state. To your second question, I can start and then others can weigh in. At this point, we don't have, as Dr. France said, we think that there's probably multiple factors at play here regarding why we're seeing a high plateau and potentially even a slight decrease in the number of cases over the last couple of days. And so I don't think that there's a single factor that we can point to at this point.
I guess I think the question was about schools. It was a little broken up, but I first of all, I totally agree with Rachel. It's very, very hard to tease out what is responsible for this. I would say that the data that has been accumulated nationally, internationally, and certainly in the metro area has been the schools have been very safe environments. When the schools have implemented the array of prevention measures that they had, in-school transmission appears to be very low. The governor has, of course, been promoting the notion that schools are really safe places to be. And I think there is some possibility that when you take kids in large groups in places where mask wearing and social distancing is relatively overseen, nothing's perfect, and you put them back into a somewhat less overseen environment, there is some possibility that that could be part of the larger community dynamic.
Great, thank you. Taylor, we're going to take it over to you, and if you could say which outlet that you're with.
Hi, Taylor Summers for NBC News Radio. We've been hearing a lot that it could take until the early summer or so for the general public to have access to the vaccine. Looking at where we stand now, what we know, is there anything that you believe could happen at the federal or state levels that could potentially accelerate that timetable?
Nothing's really coming to mind for me at this point. We know that we're dependent on the supply chain coming from both the manufacturers and the federal government. And so we have estimates about when doses will be arriving and how many, and what surprises lay ahead. Well, I guess we'll see. We do our best to map out where we think we'll be when, and knowing that there are not just these two first pharmaceutical companies providing vaccine, that there are two others that should be following up shortly, and then others yet providing more supply, makes it difficult to really do any kind of predicting on supply further than a few weeks to a month. But everything points to a good supply January, February, March, and that's certainly what we're hoping for.
Great, thank you. I believe we have time for one more question. If we did not get to your question, please send it to media_info@state.co.us, and we will get to your answer as soon as we possibly can. And with that, John Ingold, let's take it over to you.
Yeah, hi everyone. It's John Ingold from the Colorado Sun. Thanks for squeezing me in. Two quick questions. One is that chart that Dr. France showed showing side effects from the Pfizer vaccine. If I read that right, it looked like on the second dose, as many as 15 or 16% of people who received the vaccine showed a fever after that. I'm wondering what that means for hospitals and other facilities administering the vaccine, and how they need to stagger it and pace it out so they don't end up with a large number of people showing a fever, or alternately, if hospital workers will sort of be allowed now, if they've been vaccinated, to come into work if they have a fever. And then the second question, those 46,000 plus Pfizer doses that are expected to arrive potentially next week, are those expected to go into 46,000 arms, or are we thinking the state's going to hold back half of those to make sure we have the second dose available for the people who get the first dose? Thanks.
So your first question was about fever. You're right. It looks like almost 16% of vaccine recipients with dose 2 had some form of a fever. And the healthcare workers, the hospitals, have been having discussions about what this might mean in terms of how they'll do their vaccination locally. Might they do some kind of program where they only vaccinate a proportion of their total ICU staff in case people need to stay home the next day? We're looking for the ACIP to give us guidance and the CDC about how we might approach post-vaccination fevers for essential workers and healthcare workers. So I think more to come. The doses themselves, the 46,000, as I understand it, we receive 46,000 and the federal government holds back another 46,000. So we will go ahead and use all 46,000 and know that we'll be getting another shipment of 46,000 in 3 weeks. And Rachel, would there be anything that you would add to those comments?
Thank you.
All right, thank you. And I guess I'll go ahead and say, of our participants, do you have any final thoughts to add before we let everyone go today? Okay, great.
Well, I guess I would say thanks for helping us get the word out. I mean, honestly, a big part of what the citizens' response, both to taking precautions and getting ready for vaccines, is what you help us explain. So thanks for helping translate this important information to your readership and your viewers.
Hello?
Oh, I think actually I have, it looks like I can actually take one more question. So Seth, I'm going to go ahead and take yours and then we'll finish out today. Seth, if you can say which outlet you're with.
Thanks for squeezing me in too. Seth Klayman from the Denver Gazette and Colorado Springs Gazette. I'm curious about the change in prioritizations from the draft vaccine plan to yesterday's, particularly the draft plan, talked specifically about homeless shelters, prisons, dorms, some of these congregate settings, and that was largely stripped out of the final plan yesterday. So I'm curious about what happened there and why. Thank you.
I'll be happy to take that. We've been in this process of figuring out how to best prioritize it. We look for answers and ideas from our state colleagues through a medical advisory group to CDPHE and the governor. We look to federal recommendations from Advisory Committee on Immunization Practices, National Academy of Sciences too provided insight. And we look to experts in the Department of Public Health and Environment, as well as the governor's office, to help us think about what the right prioritization will be. So we are thinking about prioritization in 3 phases. The first phase, getting ready to start. Second phase being these higher risk folks, and the third phase being general people in the general public at low risk. And today we're really focused on applying the phase 1. Phase 2, as you saw yesterday, has a variety of folks listed, and we'll hear more, I think, from ACIP on their views on what that next phase should look like. Our partnership with local public health agencies like Tri-County Health and Denver Health will also give insight with the limited doses we have that need to be distributed into phase 2, where would they need to go, and who gets it first within that phase, because clearly we're not going to get the 1.8 million or 2 million doses to cover all of phase 2 all at once. So even there, we'll have to think that through. And I know that these discussions, the questions about prioritizing different groups as you described, will continue. So stay tuned.
Okay, and now we are out of time. Thank you all so much for joining us. I also want to take this opportunity to thank Mateo, our Spanish interpreter for today, as well as Abel, our ASL. We appreciate you and your time. And thank you, Dr. Herlihy, Dr. Douglas, and Dr. France. And if we didn't get to your question, please send those over to media_info@state.co.us. And I hope you guys have a great afternoon. Thank you.
Thank you.
Thank you.